You are listening to part 61 of our series, 7 Medicines, The Wise Woman Way. It's Susan Weed at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Hi, Gemini. I'm so glad to be back here with you. And glad is going to be a real operative word today because we're going to talk about depression. As a matter of fact, we're going to be talking about depression all month long. For the next 4 episodes, we're going to talk about depression. We're going to talk about what is depression, various kinds of depression, postpartum depression, and suicidal depression, and mania coupled with depression, and just all kinds of depression. We're going to see, what medicine thinks is going on when we're depressed, and then we're going to look at the drugs that they prescribe and the problems with those drugs. And there's some pretty big problems with the drugs that are prescribed for depression, starting with, do they really work? And because they probably don't really work, the placebo effect seems to be predominant, especially in drugs that deal with depression. Then we are going to spend a couple of weeks looking at the vast array of really excellent alternatives that exist to help people who are depressed, feeling blue, whatever you want to call it. That's about 158 million Americans in any given year who are reporting to healthcare professionals they are depressed. Some people say that it's probably twice that amount because many people wouldn't say anything to a healthcare professional about being depressed. And antidepressants are the third most widely used class of chronic medications in the United States, with over 25 million users. So we're not talking some minor thing here. We're talking huge numbers of people. And these are just American figures. These figures cross the boundaries. Depression is widespread, especially in industrialized nations. So what is depression? Well, it's either a thing in its own or it's part of some other thing that's going on. Let's just first of all say that for most human beings, feeling sad is not depression. Feeling sad to the point where, say, you don't get up out of bed for a day or two is also kind of normal for human beings. But once that sad starts to turn into the ordinary, then it's no longer transient sadness or transient depression. It is now clinical depression. Major clinical depression is estimated to occur in up to 20% of the world's population over the course of a lifetime. 20% of the people alive today over the course of their lifetime will have at least one major clinical depressive event. Women far more likely than men by a 2-to-1 ratio to be affected. And as usual, women are at particular risk during parts of the menstrual cycle and immediately after childbirth, that postpartum depression, which we talk about. Relatives of people who have had a major depressive episode are at higher risk of developing depression. And there's estimates that 2% of the world's population has a disorder known as depressive personality. You know, whenever I hear that, I always think, I know who some of those people are, because they walk in the room and it's like that little Mr. Fixbit that had that black cloud hovering over his head with the rain always coming out of it. There are, of course, a great many people who believe that depression is actually kind of a rational and sane response to the culture of the 21st century, which can be, to put it very mildly, can be dehumanizing, can make us feel as though we're not worthwhile, can fail to provide us with a real sense of self-worth, or that what we think or do has any real meaning in the world. And by meaning, I don't necessarily mean earth-shattering. I was talking to my daughter about the blue zones, places on the planet where people live long and healthy lives, and especially Sardinia. We were focusing in on Sardinia. And she was talking about how many of the old men there are goat herds and sheep herds. And they just go out all day long, walking around after the goats or the sheep. And I said, yes, we herd the goats here at the Wise Woman Center. And first of all, just spending a day with the goats is my absolute sure cure for depression. But deeper than that, it really builds self-worth because you've done something very simple, very natural, and yet it contributes to your well-being, to the goats' well-being, and to the well-being of the whole community because of the milk and the cheese and the yogurt that we get from the goats. So depression, well, it can be an opportunity for self-exploration. As one of my past apprentices wrote to me recently, she said, I've decided just to be who I am. Since I don't hurt myself or others, the labels and the drugs that the doctors are offering me don't seem to be something that I want to deal with. Depression can be that opportunity for self-exploration and self-acceptance. It's a wonderful book called Reinventing Eve, in which a woman talks about depressive episodes in which she goes and sits on the lap of hell, the mother of the underworld, and she comes back with a manifesto written in blood, and a manifesto written in milk, and a manifesto written in mucus. And we think about that deep return, Inanna's return, if we shall, Inanna's visit to her sister Ereshkigal, being killed. Not just depressed, but killed by that, and finding her way back. What a magnificent passage. There is, of course, a standard set of symptoms described in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders. And that is, there's poor appetite and significant weight loss, or increased appetite and significant weight gain, insomnia or increased sleep, agitation or retardation of both movement and thought, loss of interest or pleasure in the usual activities in daily life, and a decrease in sex drive, fatigue, exhaustion, loss of energy, feelings of worthlessness, self-reproach, excessive and inappropriate guilt, diminished ability to think, to concentrate, to make decisions, and recurrent thoughts of death or suicide or even suicide attempts. And it's this last one that freaks most of us out about depression. We've talked about other things, about anxiety being, a difficult mental state, but we're not so worried about anxiety, treating people with anxiety or using herbs for anxiety, because it doesn't carry this death threat, whereas depression definitely does. One of the things that happen to people when they're deeply depressed is they start to feel that the world would be better off without them. And then it's almost a gift that they could give to the rest of us to get rid of themselves. And that's scary for everybody concerned. A major depressive episode includes loss of interest or pleasure in all or almost all activities, and at least 4 of that long list of symptoms every day for a period of at least 14 days. Nowadays, we simply use mild, moderate, and severe depression, but the language used to be so much more flowery when we had melancholia and ennui, and homesickness, and all different ways of being depressed. One of today's ways of being depressed is to be bipolar. During the high points for a person with bipolar depression, there is euphoria, energy. Sleep is not needed, and there are just amazing things that you could do. So forth, you have the best self-worth in the world. The impulsive and risky behavior can lead to disorganization and incredible quickness of movement and speech that can actually tip right over into hallucinations and delusions, especially delusions of grandeur, being the only one who can do something, the only one who can save something, or understanding that some particular person is possessed, say, by a devil. However, in the depressed part of bipolar depression, there is a much deeper state of depression than there is of mania. The manic episodes usually last for a fairly short time, rarely more than a few weeks, and after that, the person plunges into a depressive episode that can last for far longer. People with major depressive symptoms may actually have a hidden form of bipolar disorder. Looking at people who reported major depression, they found that about 40% actually really had periods of hypomania which preceded their depression. As I said at the very beginning, depression is not just the other person. There's 158 million Americans in any given year who report being depressed. Major depression, severe depression, is not something that just happens because something bad happens to you. It tends to start out in childhood and early adulthood and is, as we said, far more common in women. Serious depressive illness is less frequent in the elderly. 4% of people aged 25 to 45, according to the National Institute of Mental Health, have had a major depression recently, but fewer than 1% of people over 65 have had a major depression. However, 1/3 of all antidepressants are prescribed for people 60 plus, even though they make up just 1/6 of the population. So we have hit upon our first problem with antidepressant drugs. They are overprescribed, and they are very much overprescribed to the elderly who might be sad that they've lost yet another friend or yet another pet, or that they have lost their spouse of many years, but that does not make them depressed. Grief, thanks to my teacher Elizabeth Kubler-Ross, is something that I understand and recognize to be apart from depression, even though it carries some of the same symptomology. But grief is with a far heavier heart, shall we say. In a community-based study, more than 50% of older people who had been taking antidepressants for a year or more had no history of depression. And of that 50%, half of those, 1 out of 4, were given an antidepressant medication when they asked for a sleeping pill. Antidepressants are now the 3rd most widely used class of chronic medications in the United States. Their use increased more than 4-fold between 1988 and 2008, and yet they work only 30 to 50% of the time. Over and over, while I was researching this topic, I found the statement that depression is an episodic illness. It's not like you get depressed and there you are stuck being depressed for the rest of your life unless you take medication. Bipolar depression can be like that, and because bipolar is a genetic glitch, medications work better than for the other depressions. But in most people, and even in people with manic depressive disorder, depression is an episode. It's a chapter. It's not the whole book. Recovery is to be expected. We wouldn't want to take drugs that required us to continue to take those drugs even if the condition went away, if we knew the condition was going to go away. Therefore, any treatment for depression should be something that could be stopped at any time with no consequences. As we will see, this is not true of most of the antidepressant drugs. There are reasons for depression that are a little out of what you or I might think of as causing depressions. But one cause of depression is drugs. I know. I've thought that too. I thought, do we get depressed because we're taking drugs? No. Certain drugs, including corticosteroids, oral contraceptives, and blood pressure medications, actually cause us to feel depressed. So it's quite important, if you're feeling depressed and the doctor is prescribing an antidepressant medication for you, to check to see if you're taking drugs that cause depression. And the doctor should have a full list of the specific drugs that do cause depression. And if they don't, then you're going to have to bring it to the doctor's office. Also, certain medical conditions, including hypothyroidism, pancreatic problems, especially pancreatic cancer, bowel cancer, brain cancer, and lymphoma, viral pneumonia, hepatitis, a stroke, Parkinson's, and Alzheimer's can precipitate a bout of depression. Some of these certainly will need to be treated as someone with Parkinson's or Alzheimer's or cancer or pneumonia and hepatitis, and some of them, like the depression that can follow a stroke, we can treat pretty much as a simple depression, since at this point the stroke has already happened and it isn't something that we can directly treat the way we can cancer or other problems. So, what the medical profession does suggest, and I really applaud them for that, is that if you feel depressed, you should try psychotherapy, especially if it's a minor depression. You should always try psychotherapy. Even if you are taking antidepressive drugs, you should be in psychotherapy. Now, I understand that this can take a little doing. For some people, the cost is prohibitive. Not all insurance programs pay all for doing that, but they will usually pay pretty much all for the drugs. And it may be difficult to find the right fit. Our personalities differ from person to person, and the kind of healthy and happy that you want to be may not be the same as the first therapist that you try. But having worked with a great many therapists, both as someone who's benefiting from their expertise and somebody who's working with them to share expertise, I know that there are hundreds of different types of therapy, and that there's a therapy that can help all of us to feel happier, healthier, so long as we keep looking around until we find that match there. Antidepressants are ineffective for 40% of the people who try them. Now, it doesn't make any sense that doctors would prescribe or patients take drugs if they don't have proven benefits. The question in the community is, however, how much of this is actually due to a placebo effect? This question is the focus of a growing debate in the medical community. Some severely depressed patients are helped by antidepressants, but for the vast majority of others, antidepressants are, and I quote, no better than, but clearly more dangerous than, sugar pills. For moderately depressed individuals and even many severely depressed subjects, studies continue to find that antidepressants are not meaningfully more effective than placebo. The less depressed a subject was at the start of a trial, the less effective the drugs were. It was only in the most severely depressed patients that antidepressant drugs reached any threshold for clinically significant effectiveness compared to placebo, basically compared to nothing. In 2011, a study in the Journal of Clinical Psychiatry evaluated 81 randomized controlled trials involving more than 21,000 subjects. These were submitted to the Food and Drug Administration for approval to treat depression between 1983 and 2008. the antidepressants were statistically better than placebo in only 53% of those trials. And we do not know anywhere near what we need to know about what happens if you take antidepressant drugs for long periods of time. The Food and Drug Administration doesn't require trials on antidepressants to last for more than a few weeks. But as we know, in practice, antidepressants are routinely used for much longer periods of time, and the risks persist for as long as the antidepressant is used. In many cases, unfortunately, patients end up continuing to take their antidepressant medication not because of depression, but because they get terrible withdrawal symptoms, including headache, nausea, agitation, and dizziness if they try to stop taking their drugs. It is important to realize that long-term drug treatment is not always necessary, even for serious depression. In one study, after patients had been successfully treated for 4 months with antidepressants, half were continued on drugs and the other half switched to placebo. After an additional 2 months, most of the patients, both those taking the actual drug and those taking the placebo, were still doing well. The relapse rate was the same in both groups. So if you are taking antidepressive medication, you may want to consider doing whatever you have to do to withdraw from it. One way that I was just reading about is a way to condition yourself so that when you take your antidepressant medication, you create some kind of sensory cue, such as looking at a very bright color, or eating something sweet, or listening to a particular tone. And then you start decreasing the amount of the drug that you're taking. And you keep playing the conditioning information, you keep giving yourself that conditioning information, and soon your brain will do what the drug has trained it to do with just the conditioning, and you will not need the drug at all. The side effects of antidepressant drugs are problematic and not good for us at all. We're going to be talking about the specific problems with antidepressant drugs next week. But to end up this week, I want to talk about some interesting research that's being done looking at the connection between depression and inflammation. Inflammation is generally considered to be pretty beneficial to the body. It ramps up the production of cytokines, which are proteins that help us heal and protect us from the effects of overexertion. But high levels of cytokines, inflammation, can actually contribute to depression. Only a fraction of people who have depression, that's about 20 to 30%, have high inflammation, though for people whose depression resists treatment, it can be up to half of those people. And so there aren't any treatment guidelines to figure out whose depression is connected to inflammation, but there are people for whom depression is a result of inflammation. When people who have skin cancer or chronic hepatitis C take a type of cytokine medication called interferon alpha, they have depression. Numerous studies have found that healthy adults who produce above average levels of cytokines are the ones who are most likely to develop depression as they age. In the brain, cytokines disrupt the production and release of important signaling chemicals, including serotonin, dopamine, and glutamate, which help control emotion, appetite, sleep, learning, and memory. Cytokines also activate stress hormone signaling in the brain, and that can prime the brain to lean toward depression. 4 small studies published between 2006 and 2012 found that adults diagnosed with depression who took aspirin or another anti-inflammatory drug along with an antidepressant got more relief than those who took the antidepressant alone. So one way to possibly take less of an antidepressant medication is to add a small anti-inflammatory to it, such as baby aspirin, which many doctors believe is good for your heart. There can be some bleeding problems. It's not all good, but certainly any amount less of antidepressant medication that one can take is a significant decrease in the problematic symptoms of that antidepressive medication. Well, this sounds good, and so there was a group who just said, well, we're just going to see what happens. And they thought that, they could just use anti-inflammatory drugs to treat depression and that would work for everybody, and they didn't find that. In fact, they found that they were less likely to recover from their depression when they got anti-inflammatory than those who were just getting a placebo. And it turns out that anti-inflammatory drugs can actually undermine depression treatment in some individuals. An analysis of about 1,500 people who took an anti-inflammatory drug along with an antidepressant found that it didn't really help that much. In fact, that many of those who took the anti-inflammatory drug were less likely to overcome the depression. Well, for 20 years, we thought that it was only inflammation and the inflammation in the brain that was associated with depression. But now it seems like it's not just a lot of inflammation, it's too little inflammation. So both high levels of inflammation and low levels of inflammation can actually lead to depression. It turns out that a specific level of cytokines is needed in the brain to keep us whistling zippity-doo-dah. And I remember years ago reading about sleep, and that one way to help somebody who had severe depression was to prevent them from going to sleep. Because when we sleep, because we have to lay still and not do anything, our brain produces hormones that make us depressed, right? What are we doing? We have no interest in our daily life. No, we're sound asleep. That's what sleep means, not moving, not doing anything. So the brain is producing depressive chemicals while we're sleeping to keep us asleep. And so the more you sleep, the more depressed you get. And if you can get somebody who's depressed and just keep them up all night long, whatever you have to do, then you can actually shut off the brain making all of those depressive chemicals. In one study, researchers measured levels of C-reactive protein, which are made in response to high levels of cytokines, and they did find that could help them pinpoint the people who were on the high end of the spectrum. So if you just give everybody an anti-inflammatory with their antidepressant, some people who are already low and don't have enough cytokines are going to go off that particular deep end. But by checking to see who has high C-reactive protein, which is a pretty standard test that's used to see how your blood vessels are doing, we can then say, aha, this is a person who could indeed benefit from using an anti-inflammatory along with an antidepressant to get better relief. So that's about it for this week, Gemini. It has been, as always, a delight to talk with you. Although, gosh, I know when we started the show I said it's a delight, and I could really feel the delight. And after talking about all this depression, I guess I feel a little down.
Yeah, so I'll look forward to having you next week to lift us up
Okay,
again.
let's go have fun.
Okay, let's do. Thank you so much, Susan.
You're welcome.
And this concludes part 61 of our series, The 7 Medicines, The Wise Woman Way, with Susan Wade at Time Monk Radio.